let's go back. Yeah, we have angulated and displaced. See, right in here. You've got it angulated because it's bent, and it's also displaced because the ends don't line up. So angulated and displaced fracture. There's another type. It's called a comminuted fracture. And this is, there's comminuted and there's impacted, sorry. Comminuted is where you have the bone is broken into more than 3 pieces. And an impacted fracture is where the bone ends are driven into each other. It's almost like a compression type fracture. And the last type is a greenstick fracture. With a greenstick fracture, the shaft of the bone is not completely broken. It's compressed on one side and it's splintered outward on the other. So splintered on this side, compressed on this side. So think about it. Which type of patient or which group of patients does this fracture occur in? Well, we call it a greenstick fracture because it's relative to, think of young tree branches, the very young ones, very green. If you take and try and break one of those very green sticks, all it does is sort of splinter on one side and compress on the other. So this happens in kids. Young kids who haven't fully set their bones can get greenstick fractures. All right, so that's sort of the types of fractures. I'm going to talk a little bit about some patterns, I guess. This is a Colles fracture. I mentioned that slide at the beginning was a Colles fracture. It's a Colles fracture because it's got a fracture of the distal radius, although in that picture the ulna was also broken, so there's also an ulnar fracture as well. And what you get is kind of this fork-shaped pattern right here. Yeah, it looks kind of like a fork. Pretty obvious when you see them that it's a Colles fracture, very obviously fractured. So you can see the deformity here, and you could gently palpate around and feel the deformity as well. So signs of fractures, deformity. If you see deformity, be sure to document that. That's actually kind of a big deal for billing purposes. If you document deformity, then for a Medicare claim, it's actually going to be paid out as opposed to not documenting it. So make sure you document that. It is one of the signs of a fracture. Tenderness. It usually hurts to break a bone. It's usually point tender, and it overlies the fracture site. So this is a key part of your exam. Oops, there we go. Didn't get that quite as pointed as I wanted. So the reason we do physical exams is so that we can find things like this. And if we have that point tenderness over a very particular area, then that's also something that's important to note. They're also likely to not be able to use the limb. This is a reliable sign of significant injury if it's present. However, just because they can use their limb doesn't mean that it's not broken. Some breaks still leave all of the muscles and everything intact. My little brother, when he was, I think it was 2 years old, he ended up with a greenstick fracture. But we didn't really recognize it because he was still able to use his hand without a problem. He would just occasionally grab it and say that it hurt. So it was really a few days before they actually went into the doctor and got it x-rayed. And turns out he had a fracture. And that's not terribly uncommon, especially with the greenstick fractures. So other signs, swelling and ecchymosis, which remember is bruising. Exposed fragments. If you see bones sticking out, that's a pretty good sign that it's fractured. Crepitus. Oh, crepitus. Oh, it's a terrible sensation. It's the grating of bone ends, and it's really more felt than it is heard. But it's one of those things that once you've experienced it, you don't really forget it because it's just this awful grating feeling. So it can be heard or felt, but do not actively seek this. It's uncomfortable for your patient. And it kind of might give you the heebie-jeebies because it's just, ugh, yuck. It's yuck. All right, I'm going to move into dislocations now. So dislocation is the displacement of bones from their normal positions at the joint. And this is somebody's shoulder. Somebody's shoulder. So their armpit's right there. And you can see there's clear deformity right there. This is probably, looks like an anterior dislocation, meaning it's dislocated to the front as opposed to a posterior, which is dislocated to the back. Dislocation signs are going to be deformity. This is going to be key here for you. Swelling and ecchymosis, again bruising around the joint. Pain and tenderness in the joint area. And loss of motion that's usually perceived as locked. And this is very true. These patients are usually not able to move their joint at all. it's locked in place. So wherever the dislocation actually displaces, it is stuck there. I'm going to point out a couple of these. This is a hip, either a dislocation, an anterior dislocation, or a fracture. And you can see this because he's sitting up. He doesn't have his foot turned out, and if you could measure, this heel is going to stick out farther than this one. So this one's actually back further. And I know it's hard to see that perspective here, but that is in fact the case. That the leg on the affected side is actually shortened and rotated outward. Some dislocations, however, will rotate inward. Those are actually really hard to do. So shortened and rotated outward is either a fracture or a dislocation of the hip. Sprains. Sprains are partial temporary dislocations. So you basically briefly dislocate a joint and then it just snaps right back into place. The problem is it results in some tearing of ligaments. The difference between a sprain and a dislocation is that the bone ends are not displaced from normal position. So you get no deformity. So no deformity with the sprain. Oops, sorry about that. I thought I fixed that. Okay, well, this says tenderness. One of the sprain signs is tenderness. This is swelling and ecchymosis. And this is, of course, inability to use the extremity, mostly because of pain. It hurts. It hurts really bad. I don't know if you guys have sprained your ankle or anything, but it is really uncomfortable. But there's no deformity. So with sprains, the degree of joint dislocation at the time of injury cannot be determined during the exam, and extensive damage to the neural or vascular structures may have occurred. So it's very important for us to make sure these patients go to the hospital for examination. Now a strain, it sounds very similar to a sprain, but it has a T in it, so it is a strain, and it's a muscle pull. It's an injury to the musculotendinous unit. So remember, you have, your muscle kind of comes down like this, and then you kind of have it going into that tendon, which attaches to the bone, right? And so it's really this whole kind of unit here that ends up overstretched. It's really uncomfortable. There's pain on active motion, but generally speaking, the pain is not there when the patient's sitting still.